Hi everyone, this is Dr. Devin Barley with Greenwich Bay Chiropractic right on Main Street in East Greenwich. In this video series, we're starting off talking a lot about shoulder pain. Now, what we know is that the shoulder is the most dynamic or movable joint in the body. We need a lot of motion in that shoulder and stability at the same time to get through our day-to-day and do our daily tasks. And what we know is that the shoulder, because it's so movable, it's also pretty complicated. You know, there are 8 attachments of muscles in that shoulder joint, and there's cartilage and ligaments and a whole host of different things that allow that shoulder to function. And so if you're having a degree of shoulder pain, what we need to make sure we do is isolate exactly where the problem is in the shoulder itself so that we can understand how to best treat it. Now, when we talk about treatment, the process is always going to start with a careful consultation. So what we want to do is isolate, okay, how did this happen, right? Was it a slip, fall, trauma, accident, or was it chronic repetitive use over time? We want to understand where the actual pain and dysfunction is. What things can you do? What ranges of motion can't you do? And this tells us a lot about what elements in the shoulder are actually affected, because it's not just the shoulder, right? Shoulder pain is too simple. It may be one of 8 different muscles. It may be arthritis. It may be the bone, the joint. There's a lot of things that are going on here. So once we have that full breadth, the story that you're telling us, what we want to do is now evaluate the shoulder. So we'll be doing orthopedic, neurological, functional, and range of motion tests to understand, okay, where is that dysfunction and what elements of the shoulder are actually causing it and contributing to the pain that you're experiencing. And then the third thing that we may do is take some x-rays of that shoulder joint. So we know that a big cause of shoulder pain can be degeneration or arthritis. So we want to make sure that that joint looks healthy. We want to make sure that we don't see a lot of bone spurring or underlying tissue damage, so that we can understand, okay, is this an element of the shoulder pain that you're experiencing that's contributing to the overall dysfunction and pain? And by doing that, the point is that we're able to isolate specifically where that shoulder is having that pain or dysfunction so that we can treat it effectively. And so by doing that, what we typically will have is a treatment recommendation that includes chiropractic. And chiropractic is going to be great to help mobilize the joint, to restore some of that function and mobility in there. We'll also have a customized therapeutic exercise program where we're going to strengthen the weak areas and help stimulate the areas that are underperforming in the shoulder. And that program will be specific to what's going on with you. And lastly, what we know is that sometimes in events like this, you may even have something like a tear in the shoulder. And if it's significant enough, we work really closely with other providers, orthopedic surgeons, to help get that shoulder evaluated to see if this is maybe a surgical case. Oftentimes it's not, which is great for our purposes here because we can get on top of the problem effectively. But the point is that that full evaluation is going to give you the care exactly where you need it and when you need it, so that you can get the results as quickly and safely as humanly possible. Thanks so much. We'll see you on the next video.